value-based environment. While many providers have understood the necessity and benefits of advanced care planning conversations with patients, the challenges of a busy clinic schedule, the time-intensive nature of these conversations, and lack of reimbursement up until 2016 have added to the barriers of offering a standard process for having these conversations with patients. But thankfully, beginning in 2016, CMS recognized the importance of advanced care planning and created codes to support having these conversations, meaning reimbursement. Advanced care planning is a face-to-face service between a physician or other qualified healthcare professional and a patient and/or a patient surrogate discussing advanced directives with or without completing relevant legal forms. Medicare pays for this as either a separate Part B, medically necessary service, or an optional element of a patient's annual wellness visit, which is the focus of today's webinar. To understand advanced care planning reimbursement outside of Medicare and the implications for patient financial responsibility, you will want to consult with each payer and health plan as needed. So there are two time-based CPT codes to support advanced care planning. It's the 99497 and 99498. 99497 is by far the most common one used. To bill for this code, it requires at least 16 minutes face-to-face conversation with the patient and up to 30 minutes. And CMS will reimburse $86 for this code. 99498 covers the same criteria, but includes an additional 30 minutes of conversation. So unless you have a conversation of at least 46 minutes, you will likely never use this code. So who can bill for advanced care planning services? Physicians, advanced practice nurses, physician assistants, and other licensed professionals who are authorized to independently bill for Medicare Part B services. Advanced care planning conversations delivered by individuals other than the physician or qualified health professional can be recorded using Incident to Billing Guidelines, which is only applicable to Medicare and should follow CMS guidelines. CMS requires no specific diagnosis to bill for these codes. When performed together, advanced care planning and annual wellness visit must be billed together on the same claim with modifier 33 to avoid a copay for the patient. Patients will have a copay anytime the service is provided outside of the Medicare annual wellness visit. Advanced care planning may be billed in federally qualified and rural health centers, but only one service will be paid per patient per day. These settings are paid under a special all-inclusive rate or prospective payment system in which advanced care planning is part of the bundled services. Some other benefits of advanced care planning today is that you can earn credit for advanced care planning and other value-based initiatives like your MIPS reporting in the quality and improvement activity categories, and it certainly will support keeping your overall costs down. So at this point, you may be thinking, we want to start advanced care planning, but how? Here are some easy steps to take. Start with patients already scheduled for an annual wellness visit. You can call and ask whether they could come in either 30 minutes earlier or stay 30 minutes later. For those patients to be scheduled, make sure that they understand that their appointment may be a little longer than usual. And you can always check Palmetto or other data warehouses to see if a patient has already had an annual wellness visit performed during the current year. Other considerations include, of course, initiating the conversation isn't always easy and can actually be quite uncomfortable for some. So training and resources for your providers to facilitate the conversation and mitigate discomfort may be needed. I've included some resources to facilitate having the conversation at the end of this presentation. Also, identifying your electronic health record capabilities and facilitating documentation will be very helpful. Although there currently are no specific advanced care planning documentation requirements, here is a list of some categories that are suggested to include. And some best practices include document a brief summary of the voluntary conversation. The detail should vary based on length and complexity of the conversation, which would also justify time duration. Document the time and who was present, either by start, stop time, or total time in minutes. Form completion may or may not occur. If forms are completed, document which forms were completed and maintain a copy in the record. And there are no diagnosis requirements. If a serious illness is a driver to the actual conversation, it is expected that such diagnosis will be reflected on the claim. And also worth noting, there are no limits to the number of times advanced care planning can be reported, but the ACP codes reported more than once a year for the same patient should be linked to the rationale for frequent ACP services, such as changes in clinical status, uncertainty in prognosis, significant distress in decision-making, and change in goals, level of care, or treatment preferences. And here I provided a sample advanced care planning documentation template. So you can see that you may want to document who you met with, that they were willing to discuss advanced care planning with you, and that the conversation included the value and importance of advanced care planning, experience with loved ones who have been seriously ill or have died, and so on and so forth, as you can see here. Here are some simple steps to incorporate advanced care planning into the annual wellness visit workflow. And as you can see here in both scenarios, it is very important to point out that so much of the actual visit can be performed by your support staff, which allocates more time for the provider to spend with the patient to, among other things, have a conversation regarding advanced care planning. And here's a sample checklist for an annual wellness visit that includes the advanced directive. And then another key piece of advanced care planning is the actual patient, right? And so we, the CHEX practice support team, recognize the importance of this and developed this brochure that you can see here to help educate patients so that they too understand the importance of planning and having the conversation with their primary care provider. We will send this copy of this out with the slides following the presentation, along with other resources. So to summarize the key points that we covered today, all traditional Medicare beneficiaries qualify for advanced care planning services. You may determine that it is important to have conversations about end-of-life decisions with your patients and or their caregivers annually, or when a patient has a medical change in status. And the patient has no out-of-pocket responsibility for advanced care planning that takes place during his or her Medicare annual wellness visit. And so notably, if the annual or the advanced care planning services are provided under any other circumstances, Medicare coinsurance and deductibles do apply. And Medicare and other payers value advanced care planning and are providing an opportunity to be paid for the time you commit to conversations with your patients about end-of-life decisions. And advanced care planning supports value-based initiatives, optimizing performance scores. And now we're going to open it up for any questions and or sharing lessons learned or best practices that you all have experienced. If any of you are already doing annual wellness visits on a regular basis, but may have reservations about or challenges with incorporating advanced care planning into the visit, we'd love to hear about it. So please feel free to either type a question, comment into the chat box, or unmute your phone and just please share. And as you can see here, I've also listed some useful resources that, again, we'll be sending out with the slide deck. Yeah, so we received a question that says, do you receive reimbursement with each ACP coded or only when linked with the annual wellness visit? So if it's done on the same day as the annual wellness visit, you'll get reimbursed, but you'll also get reimbursed with that code if it's used outside of the annual wellness visit. Correct me if I'm wrong, but I think the only difference is that the actual copay and or deductible will be covered if it's done during the annual wellness visit. Does that make sense?
Yes, that was my question. Thank you.
Okay, great. Are any of you already having the advanced care planning conversations with your patients and just not billing, or that seems to be a common scenario among our many of our preciouses, that they're actually doing advanced care planning but not billing for it?
Yeah, more times than not, I've talked about it, but not put it in their chart as a billable thing.
Okay. Well, if there's no more questions, I'd like to thank all of you once again for joining us today, and stay tuned for upcoming webinars on other topics. And we have our email here and phone number if you do come up with any additional questions. But we're happy to help. We're here to help.
Thank you.
All right. Thank you so much. Bye-bye.
Bye.